Early detection and diagnosis of abnormalities within the human body are the first steps towards successful treatment of many diseases. Ultrasound-assisted biopsies are a non-invasive, safe, and cost-effective method for obtaining tissue samples for clinical analysis. However, ultrasound is a two-dimensional technology often asked to function in a three-dimensional environment. Small, deep-seated lesions may be difficult to target accurately, and many times multiple needle passes and repeated insertions are necessary before performing a successful procedure.
People without a lot of experience have quite a bit of difficulty lining up the transducer with the needle and also continuing to visualize the lesion that they want to biopsy. A lot of the new speckle reduction technologies and spatial compounding oftentimes make the needle more difficult to see, including harmonics. So actually visualizing a needle has become a little bit more difficult than it used to be in the past.
The limitations of ultrasound are that there are many places in the body where it's difficult to see what you would like to see because of multiple tissue interfaces, because of bone or air where ultrasound will not penetrate.
Ascension's 3D guidance tracking technology is revolutionizing the way biopsies are performed. Using a magnetic 3D sensor attached to an ultrasound scan head in conjunction with a 0.9 mm 3D sensor embedded in the tip of an interventional needle, 3D guidance provides a virtual roadmap to targets within the human body. Civco's proprietary tracking needle offers a protective, reusable housing for the 6 degrees of freedom sensor and is able to be quickly and easily covered with a sterile sleeve, ensuring sterility. Simple insertion of the reusable needle handle into the disposable needle sheath allows an easy two-step assembly process. When assembled with a Civco tracking bracket, the system allows simultaneous tracking of the needle and ultrasound scan planes. This enables real-time 3D guidance from the needle's puncture path to an internal lesion for increased clinical confidence. If preoperative imaging is indicated for selecting the best interventional path or for comparing the results of different imaging modalities, the 3D sensors can also be used to align the freehand ultrasound image with the preoperative image in a process called fusion. For biopsy and ablation procedures, the sensors integrate real-time spatial data with visualization software that overlay video images on the ultrasound monitor's B-scan plane. Importantly for medical environments, our DC magnetic sensing technology is immune to distortion from nearby metal objects, so it delivers precise, clean data the first time, every time. The physician can now monitor the real-time needle trajectory through delicate anatomy to the geometric center of an internal target, such as a tumor, cyst, or polyp. It allows the practitioner to clearly visualize the exact location of the needle, either in or out of plane, for a longitudinal or transverse approach. The use of an open-channel needle guide offers increased confidence with in-plane positioning during procedures where access is difficult. Before the skin is punctured, the system registers the biopsy needle to the center of the target, and it graphically presents the precise path the needle should take to enter the center of the lesion while avoiding collateral damage. As the needle punctures the skin and advances towards its internal target, the superimposed graphics provide real-time feedback as to its exact location. It is the ultimate hand-eye coordinator. Once optimally positioned, the needle can be rotated to a perpendicular plane to provide three-dimensional verification that the tip is on target. One or more targets can also be marked and mapped for follow-up. The process of quickly navigating through the real-time map to the predefined target is quick and efficient. Most procedures are accomplished in a single pass. In addition to allowing 3D visualization, the system provides 100% confirmation of biopsy success.
This technology allows the needle to be visualized accurately by having a sensor array that shows exactly where the needle is with a high degree of accuracy in a very obvious way.
The advantages of using this tool set are that it makes the procedure much safer for the patient. It potentially speeds things up enormously. And it is quite cost effective to use these components.
Adding 3D navigation to current ultrasound platforms is fast, easy, and cost-effective. The system consists of at least 2 DC magnetic sensors, 1 transmitter, and an electronics unit. The 0.9 millimeter sensor will fit into the tip of a needle as small as 19 gauge. Millions of ultrasound-assisted biopsies are already performed each year in the United States alone. As this number increases and we strive for cost-effective and improved treatment outcomes, it will be more important than ever to get to the point the first time with 3D guidance.